Hi, my name is Carrie Tabor, and I'm the CEO of 1stSeniorCare. Today we're going to talk about ceiling lifts. Who needs them and who would benefit from them? And what are they? A ceiling lift is a track system that is installed on the ceiling. It has a motor attached, and a sling is attached to that motor. There are several different types of motors. Some are for bariatric patients. Some of them are designed to move along the track system, to move a person from one place to another, room to room, and some are stretcher lifts. The primary function of these motors is to safely and easily move a patient, usually from a bed, into another conveyance, such as a tub or a chair. The advantage of this track system is that it can significantly reduce caregiver back injuries. Back injuries are the most common disabilities among caregivers. According to a recent study by the American Nursing Association, they have actually encouraged hospitals and nursing homes to adopt a zero lift or no lift program in order to prevent orthopedic injuries with healthcare workers. So why are these injuries so common? Well, part of the reason is the manner in which one must lift someone in a bed, either to lift them out of the bed or to reposition them. And what happens is you must lean over the person and lift them up with your arms, which causes you to use your abs or your back muscles. Now, your abs and back muscles can do that lifting, but only for short durations of time. And frequently, these procedures are repeated over and over throughout the day. So at the end of the day, the caregiver goes, "Oh man, my back hurts." And that then is repeated day after day, which then can potentially escalate into, "Oh man, I'm not moving that way today," which can eventually escalate into going to a doctor and finding out that you have a slipped disc or a herniated disc, at which point in time you won't be moving anything. So now that we understand that the mechanics of lifting and how in most situations this is done improperly, it becomes clear why a ceiling lift that promotes proper positioning for lifting can reduce caregiver injury and potentially reduce liability insurance, disability claims, workman compensation claims, and unemployment claims for assisted living facilities, and other care facilities, even those such as hospitals. Well, one of the benefits is an increased floor space, which then can be used for life-saving equipment. Other benefits are a decreased risk in caregiver back injury due to improper lifting, an increased independence for the patient that is already independent but may have a sudden downturn. Also, there is increased independence for the patient because now they can take care of their own personal hygiene routine, and this also promotes a dignity amongst that patient. Additional benefits are that these lift systems can be used as a rehabilitation tool to actually help people learn how to walk again. The ceiling lift systems can, as previously stated, also reduce your liability insurance, your workman's comp claims, your disability insurance, and your unemployment claims. It can also promote a continuity between caregivers and clients. So without your caregivers being injured, you will have the same caregivers dealing with the same clients, which promotes a trust between the clients and the caregivers. And it can increase the caregiver's efficiency. The overall cost of a ceiling system can be as low as $5,000 or $6,000. However, if you as a facility have a caregiver injured on your watch and they have to have back surgery, that could be up to $50,000. So which would you rather spend, the $50,000 or the $5,000? I would rather not only spend the $5,000, but in spending that $5,000, then I would want to be able to, in making that investment, show my caregivers that I am investing in them and I am investing in their long-term health, and that will give them a feeling of appreciation and trust in me as an owner of a facility. It also lowers the fears for potential accidents. If you are lifting manually, you can always have muscle spasms that might cause you to temporarily lower that person, and that patient may have a sense that they are being dropped. So this encourages more trust in a caregiver and in a transfer. When a patient is unable to easily move themselves, you can provide the proper equipment for them to help them move from place to place. You can help them become more a part of not only their own family situation, but also become more a part of the community if they are in a facility, because they can have the motivation themselves to move themselves into that community. And we all know that if you are in a community, once that patient decides that they do not want to go out of their room any longer, that is the beginning of a long-term downturn. And none of us wants that. We want to promote community. We want to promote involvement. So these are just some of the benefits of being able to use the ceiling lift system.
Hello, my name is Steve Tabor, and I'm the administrator of 1stSeniorCare and also vice president. But I'm also a certified barrier-free lift installer. I've installed multiple systems myself. At this time, we'd like to do some review of the install procedures so that you have an idea of what is actually involved with being able to do a quality installation. To begin, the normal installation requires that we have either a room layout or some pictures of where we need to actually install. That is used to be able to determine the total number of products that are going to be needed, and we get our order correct so that when everything arrives, the installer doesn't have any problem being able to do the installation. To begin, we prepare by unpacking all the materials that are usually delivered to the location for the install. Then our installer takes and evaluates based on the packing list that he's been provided to make sure that everything arrived in good order. At this point, the rooms have been identified, and subsequently the track is moved to the room in which the install will take place. Depending on the type of install, the number of pieces of track would be put in the actual rooms, and actually ceiling clamps and track clamps would also be included with that. At this point, he identified the attic access points, and subsequently he will be moving the unistrut and other saddle nuts and other equipment that he would need for being able to support the lift track above the ceiling. So at this point, he has unpacked the materials, he's laid out the track, and so he's placing track clamps approximately every 2 feet along the track so that he knows exactly where above that, using a laser, he would be able to identify where in the attic he needs to put his unistrut. We use a vertical laser for that marking of the positions, and then find the center above the center of each one of the track clamps. And in this particular case, he uses a brad to identify that exact location. At this point, he would make sure that he is not actually going through one of the truss members up above, and by using a stud finder. And if in fact he is free of that, then he can drill a 1/2-inch hole, which will be used for the all thread or bolt to be able to attach to the attic mounted unistrut. We usually use a Lexan rod or another rod to be able to identify the holes where that he has drilled in the ceiling, so that he has a better idea of where he is in the attic. If going parallel to trusses, we have to cross at least 3 trusses with our unistrut, and the unistrut is actually secured to the upstairs trusses or the attic trusses using a screw as well as a washer to make sure that it doesn't move. Once the awl thread is dropped through the saddle nuts and the unistrut into the actual room, then he can go back downstairs and attach the ceiling clamps to the actual ceiling. At the same time, he would go ahead and put in the actual nuts that are required for the install of the track clamps, because there are retainers in each one of the ceiling clamps. Once the track is raised, usually using parachute cord or a nylon strap with the cord lock, the track can be raised to the ceiling, and the install of the track clamps to the ceiling clamps is performed with a 10 millimeter metric Allen wrench. Once the track is secured to the ceiling and the bolts are tight, he verifies level, and then he is ready to be able to put on the lift, or in the case of an H-track, he puts on the secondary cross member that is used for being able to put the lift on that cross member, so that on an H-track system you can cover all of the area between the two parallel tracks with the lift, and lift virtually all of the room that is installed in. In the case of a single track system, we use a portable lift called a PC2, and this is a track roller bar that rolls in the track and has a hook that the loop on the lift actually goes onto, which allows the person to be pulled upwards. This is a portable lift, and it can go down or it can go up. And it hangs on a hook up above that is shown here. This loop is just put on this hook that is attached to the track, and the lift is then powered up and down. In the event that we're having a C-series lift installed, as is pictured here, we have brushes on the lift that actually contact copper strip that is in the track. So that when that lift is put in place, we actually are continuously charging the lift, which increases battery life and reduces the maintenance required on the actual lift for battery replacement. In this particular case, we are actually putting on power directly through the copper strip all the way to the lift. So this is video of our technician actually installing that power supply and attaching it to be able to have the continuous power in the central section of the H-track. On the H-track system, it is imperative that actually the two sides of the H are completely level, and subsequently that allows for virtually effortless movement of the center section, and that makes the job of the caregiver much easier, and it just allows the system to work more consistently. Please be advised that barrier-free lifts can only be installed by certified barrier-free installers or a licensed contractor under the direction of a certified barrier-free installer. Special thanks to our technician for his expertise in being able to install these ceiling-mounted lift systems.
So today we want to thank you for viewing our video. We hope that you have found it informative, and we appreciate your questions and comments.
1stSeniorCare, 1stSeniorCare.com is where you can find these products, and you can call us toll-free at 866-822-7348 if you so desire personal counsel.